Dentists are not well-adjusted people. Introducing Horace Wells, possibly the most tragic figure in medical history. He had a specific obsession. He was convinced there had to be a way to eliminate pain during dental procedures. He didn't know how yet, he just knew it was possible. On December 10th, 1844, he and his wife attended a public exhibition by a showman named Gardner Quincy Colton. The advertisement read, "A grand exhibition of effects produced by inhaling laughing gas." It was entertainment. Colton invited volunteers to inhale nitrous oxide and perform for an audience while intoxicated. One of those volunteers that evening was a young apothecary clerk named Samuel Cooley. Cooley inhaled the gas and became overly intoxicated. He was giddy, running around the stage, and ran directly into a wooden bench, badly bruising his leg. Wells watched. When the effects of the gas wore off, Cooley had no idea he was hurt. None. Wells asked him directly, "Did you feel any pain when you hit the bench?" Cooley said no. He hadn't even noticed the injury. The room kept laughing. Wells sat completely still. The following morning, he called Colton to his office. He arranged for his colleague John Riggs to be present. He had Colton administered nitrous oxide gas, while Riggs extracted one of Wells' own wisdom teeth. When he was done, he reportedly exclaimed, "It is the greatest discovery ever made. I didn't feel as much as the prick of a pin." He discovered surgical anesthesia because he watched someone run to a bench at a comedy show. He spent the next several weeks using nitrous oxide on his patients with great success. People across Vermont were receiving sedated dentistry, while the rest of the world was still screaming in chairs. Time to go mainstream. He had one of his former students and business partners arrange a demonstration in Boston for the medical community. That student's name was William Morton. Side note, William Morton was a jerk. He tried to steal Wells' discovery and patent it. Back to the main story. The demonstration was supposed to be straightforward. Wells had a patient agree to have a tooth extracted under nitrous in front of his colleagues. It was a disaster. The patient was screaming in the chair. Whether he didn't receive enough or he was simply crying out from the disorientation, the audience heard screaming and concluded the whole thing was a fraud. Wells was booed. He was laughed off the stage. The Boston medical establishment declared it a humbug affair. He returned home devastated. He dissolved his practice. Morton, his former student, went on to develop other anesthesia and successfully demonstrated it to thunderous applause. The discovery that Wells had made 2 years earlier, which Morton had watched fail, was now being attributed to someone else. In the stress and grief of watching his discovery be taken, Wells began self-experimenting with new chemical agents. He was inhaling chloroform regularly. Chloroform is neurotoxic with repeated exposure. His wife described a radical transformation in his personality. He was becoming increasingly erratic, impulsive, and delusional. Wells was destroying his own mind, one inhalation at a time. By January 1848, he had moved to New York City alone, leaving Elizabeth and her son back home. On the morning of January 21st, 1848, on his 33rd birthday, under the influence of chloroform, Horace Wells walked out of his house and threw sulfuric acid at 2 women on the street. He was arrested and imprisoned in the Tombs, New York City's infamous house of detention. When the chloroform wore off and he understood what had happened, he was done. He wrote a final letter to his wife. He begged forgiveness from God and from Elizabeth. He managed to get chloroform smuggled into his cell with his toiletries. He administered it to himself, and while anesthetized the way he always wanted his patients to be, he cut his left femoral artery with the razor. A guard found him dead the following morning. He was 33 years old. Tragic, but it gets even worse. He didn't know. Nobody told him. He died in a prison cell while a foreign medical society was voted to give him the recognition he had spent the last 4 years of his life desperately trying to obtain. The American Dental Association formally recognized Wells as the discoverer of anesthesia in 1864, The American Medical Association followed in 1870. Horace Wells never heard either of those things. He died 3 days after his arrest in a cell in New York at age 33 with a razor in his hand and the smell of chloroform in the air. Before he took his own life, he quietly helped other dentists learn to use nitrous oxide, sharing the technique for free, never seeking a patent, because he believed that freedom from pain should be as free as the air we breathe. He gave away one of the greatest medical discoveries of the 19th century and died in prison for it. Wells may have died a hero, maybe not as much of a hero as the next guy, who you probably know. If you're liking my content so far, please like, subscribe, and comment. It helps me grow my channel. And you get my sincere appreciation for sharing the same curiosity as I do.